Great, thank you. And I encourage everybody to continue to send your questions and comments on Poll Everywhere. And for those on the webcast, we are watching those as they stream in on two gigantic screens in the room. So you're very present. Please continue to submit your questions and comments. So I'd like to introduce our next pair of speakers. One is Tara Westman is a program manager with the California Endowment, a health foundation established in 1996 with the mission of expanding access to affordable, quality health care for underserved individuals and communities, and promoting foundational improvements in the health status of all Californians. There she serves as a member of the South Region team that focuses on 6 Southern California communities through the Building Health Communities initiatives, and we'll hear more about that from Tara. I'd also like to introduce Vivian Gadsden. She's the William T. Carter Professor of Child Development, Professor of Education, and Director of the National Center on Fathers and Families at the University of Pennsylvania. She's also on the faculties of African Studies and Gender, Sexuality, and Women's Studies at Penn. She's the president of the American Educational Research Association, and her research and scholarly interests focus on children and families across the life course who are at greatest risks for academic and social vulnerability by virtue of race, gender, ethnicity, poverty, and immigrant status. And Vivian had the absolute pleasure of also serving as the chair of our Parenting Matters Consensus Study. So if anyone's interested in parenting, you can search that through the National Academies Press.
Welcome both. I know both of you from the work that you do, Tara, with the foundation, and Vivian in the research that you do, and recognizing that all researchers are community-based. I know your work is. You certainly have a unique perspective in terms of being among community members, and I'd just love to hear from both of you how you have worked with and informed by communities in working towards health equity, how that's moved your research, how that's moved foundation priorities.
Thank you, Antonia. It's always good to see you.
We don't see each other on Penn's
each other
campus.
in Philadelphia on Penn's campus, but here we see each other. One of the things I want to say is that we recently did a paper on intersectionality, health disparities, and social determinants. And so it's from that point, that perspective, that I will talk a little bit. I am always reminded of the imminent limitations of focusing on a single identity strand. Let's say that's race, and without noting and planning for the multiple identities of the people whom we study. Any one identity lends itself to challenges of structural barriers, racial discrimination, the list goes on. But when those different identities intersect, they can create such a wall, so in terms of trying to get support over time. And many people, we are all like that. And if you don't think we are, next time you go to the doctor or next time you're a part of a study, think about which one of your identities you would like them to focus on. Which ailment would you like us to focus on? When I think of challenges, though, in particular, I've identified 5 in anticipation of this question. One has to do with our kind of love for a single story. A story that can be addressed with a single conceptualization or a single methodology. Another is a reliance on immutable categories. So you're white or black, you're a male or female. And yet race itself has been considered a social construction, so it's kind of odd that we rely on that. We are trained as researchers not to recognize the multidimensionality, but to look for items that can be generalized across time and space. And then there are limitations of existing methodologies and conceptualizations. There is a failure of paradigms to shift as we gain new information and new knowledge. The fourth is that there is some discomfort with the focus on culture. I'm a psychologist, and I often joke that psychologists actually fear the word culture because it's messy. It doesn't allow you to identify one single thing. And then we have the big C for culture, and then the smaller C's that have to do with the ways in which people live their lives and interpret their lives and their environments every day. Third, there are models that are single domain, let's say medicine, or single disciplinary. And one of the beauties of this discussion about the culture of health is drawing upon interdisciplinary and transdisciplinary work, thinking more broadly about epistemologies. Now, we can make a statement about how then we go into communities. And in my own work, I have found that going into those communities without assumptions about what I would find, and of course we all have some assumptions, but having as few assumptions as possible has been the greatest asset. Irrespective of how, and there's been a lot of talk about trying to connect with community members. The reality is that if you are not a member of that community and you go into that community, you really have to acknowledge the fact that you are not a member of that community and that you are learning from being a part of that by coming in. And I think it was the last speaker who talked about the reciprocity between the researcher and the community. I went into one community in West Philadelphia where we are, and I thought I was pretty down to earth and I had done all the work of engaging people. And then one of my students realized that I was on Twitter, they had YouTube or something, because they had literally taken pictures of my presence there and about all the things that I did. Now, they did it as a compliment to me, but I was a little embarrassed about it because that was not the environment that I was trying to create or the culture. But then we were able to work through that. And so there is a certain kind of, even with the best intentions, there's a certain kind of acclaim, a certain kind of overindulgence that is given to researchers who come into those environments. And the idea that we're going to walk in, and even within a month, that we're going to forge those kinds of relationships that will yield what we want to yield will be naive. I think other people have said this. This is long-term, strategic, deeply committed work to get people to trust you and to create a sense of mutual respect and trust.
And I think that, your comments here just give us a basis for research isn't the answer. It's one tool, and there are lots of issues fraught with that, and almost a contra when we go into communities. And so it's like, shedding what it is that we have with the methodologies, with the perspectives, what our funding agencies have to be able to respond to those community needs. So I always think that there's a lot more flexibility in foundations and their approaches, so I'd love to hear your perspective.
So, yeah. Hi. Building Healthy Communities is a 10-year initiative that started in 2010. And the California Endowment, we're a health foundation, and we decided to partner with 14 communities throughout the state of California. And those 14 communities are very different from one another. And we used research and other ways of identifying what potential communities we could work with. We started with 40 different candidates and narrowed it down to 14, and ultimately looked at whether these were communities that were ripe for this initiative and those that were not. And what we found is that all our initial analysis that we did was pretty way off. Once we got into communities and started working with groups, we identified that some of the things were right and some of the things were not. Our approach is we have what we call 5 drivers of change. One is adult and people power. that people make the decisions. We build the power of people to lead the changes that they want to see in their communities. A corollary to that is the important aspect of youth and youth development, youth leadership, and youth organizing. Added to that was this idea of changing the narrative, changing the stories that people tell about communities, as well as what is the notion of health, what constitutes health. And I think, we use some of the zip code data very much to start that change in narrative and what people thought was health, that your zip code was more important than your genetic code. And that was somewhat new and different for people to even consider. The other two areas are collaboration. And so what we funded were hub organizations in these communities to bring people together. And we mainly invested in community organizing groups. We're the largest funder of community organizing in the United States. And we know that if there aren't anchor established organizations who have the trust and knowledge and work well with community members, that we would be not only taking advantage of the power that we hold as a funder, but that we would not be credible. And then the last area is really leveraging partnerships and resources, whether they're public or private. And the last thing I'll say is that for us, it's really about policy and systems change. We don't fund direct services, but we're promoting policy and changes in communities that can really affect the trajectory of all communities. And just to touch on this issue of intersectionality, we did not start with that as a framework, but it has definitely risen during our first 6 years of the initiative. And that's because people do come with multiple identities. And we found something what some of my colleagues call the oppression Olympics, where people are trying to compare, their oppressions versus other oppressions, and that don't really serve to move the policies forward. And so with the idea that we are working in solidarity, and that we understand that health equity is really for all people, and when we figure out who is not part of that all, that leads us to the right place for where policies should go. So that's a little bit about how we work with communities.
One of the questions that comes up here, I think, is really interesting, and it goes back to this issue of creating a shared value of health within communities. And then how do you reconcile that both as a funder and as a researcher? We may have, community might have ideas about what intended outcomes might be, but that's not what they're funded, that's not what they're funded for. So it almost becomes in priorities a secondary outcome or a secondary issue. So just interested to see how you've reconciled, again, conflicting desired outcomes and even desired perspectives about what you're there for and what you should be doing.
We started off, in order to address some of this, we started off with establishing 10 outcomes that communities could choose from in developing their health campaigns. And we felt like that was a way to kind of put some parameters around what was in and what was out. Quickly, the priorities that emerged were in areas that were not necessarily a comfort level for our board. And so that was in areas of economic development, gentrification, anti-displacement issues, criminal justice reform. There were a lot of areas that rose up that we did not anticipate that we would be working in. And so what I would say as a foundation is that we really took this as we need to have a continuous feedback loop to figure out what it is where there's energy and also where there's opportunity. There were policy changes in the state of California that people wanted to take advantage of. And so why not allow people to move in those directions? And so it's really been a back and forth. And I would say our program staff, who are really at the community level, have been the messengers of bringing that back. But we've also tried to bring not only our executives, but our board members into communities to hear directly from people about what they are passionate about, where they think the opportunities are. And that has done more to change minds than I think anything that we could have done otherwise.
That's pretty courageous from your board. Yeah. Vivian.
Well,
There are constraints that researchers have, to say the least. However, one of the things that we know is if we do enough homework about the community, that's a first step. I think another thing is to recognize that despite one's best intentions, not everyone actually is going to be able to do work in communities, at least going out into the communities. And I think recognizing what those strengths are among the researchers themselves. So there are the commitments that you have to whatever the research design was for the study. And then there's this other kind of, if we think of these as concentric circles, that's clearly in the middle. But then there are these other circles that allow you to do exactly what Tara said, to have meetings with community members to understand more about their needs. You know, there's fine ethnographic work, so here's an opportunity to think about the multiple methodologies that can be used. And I know people get, I think it was Dr. Butler today that talked about science and rigor, but not everything has to be in that core research design that will require experimental or evidence-based approaches. There is something called professional wisdom that can inform our research studies as well. So we think of intersectionality as a kind of framing. What we do as research would be considered a kind of knowledge project, right? And these would be opportunities to get to know what goes on within those communities and using that data over time. For the projects that we have in Philadelphia, we actually spent about a year or more just volunteering, just being around the folks with no expectation. Well, actually we did have an expectation, but with a kind of honored expectation about potentially doing the study. But the truth of the matter is that I was prepared not to do the study in that neighborhood if it did not work out. I had the freedom to do that because our funding came from a foundation. But once we were seeking larger funding from a federal source, it was a little more difficult. So there are the data that you must collect for the study. And then foundations have been absolutely outstanding in providing resources to be able to collect other kinds of information, to engage people in other ways, be that in small groups. And one of the projects we have is actually around health and education disparities, where participants actually surveyed their own neighborhoods. So the assumption is that people know exactly what's happening in the block next to them. Well, we found out that they didn't. So there's a protocol that they have that they take, and they actually walk around their own neighborhoods. They get to know how many grocery stores there are and how many liquor stores there are and what kids are doing and whether there are abandoned houses. And so by helping them to become acquainted or reacquainted, as the case might be, with their communities, they have an opportunity to forge a kind of different relationship with the spaces in which they live and to reimagine themselves within those spaces.
Vivian, you've provided a really good example at an investigator level, community level, how the synergy between research funding and foundation funding can help the work that you're doing in communities. Tara, I'd be interested to hear from you. What are effective strategies that your foundation has done in working with other sectors who do research, whether it be government, whether it be universities, that have you've used to both inform the agenda and to support the movement going forward?
We have very good relationships with many of the educational institutions in California, and so there are surveys such as the Children's Interview Survey that's run by UCLA that's really essential for understanding children's health in the state of California. And what we've done is we've actually funded some oversampling for our sites so that they can get even better data for the 14 communities in which we're active. We've also supported, you were mentioning participatory action research. We've supported a number of projects around that. And that it's not only for validating, which is a really important aspect of that research, but it's an engagement tool. And for us, us and for community organizers to bring people, especially around environmental health issues and issues of the built environment, it's been very effective for that to occur. In other areas, sometimes we've used data to help us target where our investments go. So for example, the state of California last year made its own resources available for us to extend Medicaid coverage to all children in the state of California, including those who are undocumented. And this was the last 3% of children in the state who did not have health coverage. And so we were able to identify which are the counties, where are the neighborhoods, where are the places that this money should be deployed to help this happen, along with because the state didn't have the resources to be able to do all the education and outreach. So those are ways in which we've tried to use research for the benefit of communities. The way they've used it themselves, and this is an emerging area for us. A lot of budget analysis. We've got policy groups and advocates that really want to have more transparency about public spending. And so they are looking at contrasting investments in youth development versus investments in incarceration and other downstream interventions that are happening. And they want to use that in their own advocacy for creating a youth fund or creating youth councils. And so this is an area where I think it's almost using some legal tactics along like freedom of information requests, but it's also getting researchers who can work well with communities and work well with the government representatives to be able to get that data and to make it understandable, but also for it to have credibility. And then the last area, I'll say health impact assessments have been another area that we have invested in around policy changes and what are the health impacts of those policies that are being proposed. I will say there's a troubling development is that increasingly our elected officials are not seeing those as unbiased and they don't believe them. And they see them as an advocacy tool and not as something that is really objective. And that is something that's very troubling around development, because we've got a number of groups that are working on anti-displacement around our urban cores. And if they don't say health impact assessments as being objective or as useful information, then our policymakers are going to be increasingly allowing developers to do what they want to do.
I think that's a challenge we're all going to be facing very soon. But please join me in thanking Tara and Vivian for their thoughtful comments. Thank you.